Hi, I'm Jillian.
I'm Amy.
And I'm Danielle.
And we're occupational therapists at Helping Hand Center's Outpatient Clinic. A question we get asked often is, what is occupational therapy? As occupational therapists, we work with clients to be as successful and independent in their daily occupations. We define occupation as any activity a person engages with during their day. And so although we work with clients across the lifespan here at Helping Hand Center, today we're going to focus primarily on our pediatric population. So for kids, the occupations that we focus on are play, self-care, academics, and social interactions.
Children are typically referred to occupational therapy in the outpatient clinic pediatric setting for general developmental delays, self-care challenges, fine motor difficulties, eye-hand coordination challenges, decreased strength and endurance affecting function, social difficulties, poor visual skills, and challenges with sensory processing and social emotional skills, any of which affects the child's functional participation in occupation. Through therapy, our goal is to help our clients, regardless of diagnosis or concerns, be as functional and independent as possible in their everyday occupations. As pediatric OTs, we are uniquely trained in what we call task analysis, and this means that we are the ultimate puzzle solvers. We look at all the different small skills that go into making an overall functional task or activity successful and help our clients overcome any challenges that they may be facing. For example, if a child is struggling with getting dressed in the morning, we may work on fine motor and visual motor skills to help tasks such as buttoning and zippering go smoother. We may address gross motor skills to help with coordination and motor planning when dealing with clothing management and putting on shoes. Or we may work with the parent and child in addressing organizational concerns if remembering to complete dressing tasks in a timely manner each morning is the overall challenge. Often we address occupations directly in therapy, but disguise our treatment as play. OTs understand that so much of childhood learning and skill refinement happens through everyday play and engagement opportunities that the child is excited and motivated to engage in. Children, regardless of their diagnosis or the challenges they are experiencing, learn best when they are feeling, moving, sensing, and experiencing with their whole bodies, often referred to as sensory processing.
When we say sensory processing, we are referring to the ability to take in information from the environment in our body, interpret the information accurately, and respond appropriately to it. There are generally 8 sensory systems you'll hear occupational therapists talking about. The tactile system, which is our sense of touch, the vestibular system, or our sense of balance, the proprioceptive system, which refers to our body awareness, the auditory system, which is hearing, the visual system, which is sight, the olfactory system, or our sense of smell, the gustatory system, our sense of taste, and the interoceptive system, which refers to the sensations related to our physiology like hunger, thirst, respiration, etc. When a child has difficulty with sensory processing, they can be struggling with one or more of these areas. As occupational therapists, our goal is to facilitate meaningful sensory experiences to meet a child's specific individualized needs and improve their overall function. In general, regardless of age or diagnosis, a child learns best when a multisensory approach to learning is used. Stay tuned for more information about sensory processing in the future, as we know this is a confusing and often misunderstood area of occupational therapy.
Hopefully this video has given you a better idea of how occupational therapy could help your child or other children in your life. If you have any questions about pediatric occupational therapy in your child, please feel free to give us a call at Helping Hand Center's Outpatient Clinic. Thanks for watching!